Hello and welcome to Jessica's Virtual Learning Office. All right, so today we will be learning about how to insert an NG tube, how to assure the proper placement, and how to discontinue the NG tube when it's time. So you're going to need the dual lumen stomach tube, some tape, and the lubricating jelly. So of course we'll do our D-wipes before we begin, but after you've performed your hand hygiene and assured the patient understands the procedure being done, you'll go ahead and first sit your patient up in a high fowlers position, sitting upright, and you're going to assess each nair for patency to try to decide which one to go for. Then you're going to go ahead and measure the distance that we're going to need of the tubing. So of course you'll set up your supplies already at this point, and you will measure the distance from the tip of the nose to the ear down to the xiphoid process. Once you've determined this point where it's going to be exiting the nasal passage, we will go ahead and use that tape we talked about and make a little marker so we know how far we're going to put the tube in the patient. So we're going to go ahead and bend at about 4 to 6 inches and just kind of make a little bend for the passageway into the nose, make it a little easier. And then we'll go ahead and lubricate the first 4 to 6 inches to get it started as well, or 3 to 4 inches. So you're going to tell the patient to extend their neck all the way up and back with a pillow behind their head. And you're going to go ahead and slowly insert this tube with the bent edge down. And you're going to go ahead and go into the nose. And you're going to, of course, stop if you feel resistance. Just pull back a little bit and then try rotating the tube and keep going. But don't ever try to push past the resistance if you can't get through there. If that happens, you might need to go ahead and re-lubricate and then try for the other side. Okay, so then after all of that and it does successfully go in, you're going to go past the insertion till you get to the nasal pharynx area and rotate it towards the other side, and then you'll be able to go ahead and use your downward pressure to go and past the oropharynx. And then at that point, once you're in that bar, you can tell the patient to put their head down at this point and give them water and have them take sips of water as you continue to advance the tube. You'll advance it every time they take a sip, so the swallow kind of helps take the tube down with it. You're going to keep going another 1 to 2 inches and make sure that they aren't choking, gagging, coughing, things like that. If they are, pull back and stop. And if they need, you can go ahead and let them rest a minute, take a breather, and then continue again with the sips of water to go ahead and get it back down. Now, if the patient is NPO or it's contraindicated for them to swallow water with this, they can swallow dryly, or they can use a straw to kind of swallow air and still go through the same motions of swallowing to help get the tube down. Once you get all the way down to this part where the tape is, we're going to not assume we're in the right position, because then we're going to go ahead and verify the proper placement, but we're going to temporarily use another piece of tape and secure it to their nose or their cheek and go ahead and make sure it stays in place at that point. That way we can move forward and verify the placement. All right, so that's part 1. Stand by for part 2.